Hi folks, Dr. David Kulla here with Synergy Wellness in New York. If you've ever sprained your ankle and didn't get any therapy after, maybe it was a light sprain or like this gentleman right here, right? You never got any treatment for your sprained ankle when you did it?
Nope.
Yes, don't do that, especially if you sprain your ankle more than once. I'll explain why in a minute. So for any of you that have sprained their ankle, never had it treated with PT and are still having pain months later, that's not normal. That's not good. Okay, now, first you have to determine whether it's a low ankle or high ankle sprain. That's pretty easy to tell. Usually it's a low ankle, unless he already had ankle taped and it was a sports injury, right? That's not what happened here. It was a sports injury, right? Basketball?
Yep, it was basketball.
Basketball, but he didn't have his ankle taped. So it's a low ankle sprain, which is better. Low ankle sprains heal faster than high ankle sprains, typically. Okay, so with cold laser, a high ankle sprain will heal just as fast as a low ankle sprain. High ankle sprains can heal really fast, 40 to 50% faster with cold laser therapy. So we're gonna sandwich his ankle with 2 lasers. All right. How are you feeling, by the way? We've done, I think, 2 treatments so far. How are you doing?
Doing good. Yeah, it's definitely feeling better.
Where are we at now after 2 treatments? 10, 15% improvement, or not even that much, or more?
No, I'd say like 15, 20%.
Okay. So what we're gonna do here is, this laser here only works on one program, whereas this laser, the blue one here, the handheld, can work off of multiple frequencies and do sweeps. So I'm going to go ahead and with this laser, this is a great laser. This is the MR5 Active Pro by Multi Radiance, and it's got the enhanced laser stim on it. So what I can do is I can scan his leg and check for areas of soft tissue inflammation and soft tissue damage. We're gonna go ahead and scan that leg right now. And if you hear it beep, it's either a false alarm or it's muscle damage, soft tissue damage, or inflammation. Now I could tell if it's false alarm because light stays white, and that is not a false alarm. You heard that beep right there. So we're gonna take it off the skin, reset it, and now it's gonna dose that area, and it'll tell us even for how long, okay? And then I'm gonna scan the whole side of the ankle, the outside of the ankle, all the way down to the ankle, to the foot, underneath the malleolus. And the malleolus is that little knuckle that you have on the outside of your ankle, and you also have one on the inside of your ankle. So we'll go even around that and over that and scan the whole area, and it's still dosing. You'll hear it beep again if my mouth isn't going, and you can hear it over me talking. There you go. Okay, so now we're gonna reset it, and we're gonna scan down here all the way down to the malleolus. We're gonna go around it. And here's where we can get some false alarms and that is not a false alarm, because it's uneven surface around the malleolus. And I just reset it. Now we're gonna dose that area right there. Now, he had a mild sprain, and look how quick that was. So that dosed pretty quick, but we're gonna run the scanner over it again just to double check. And a lot of times it'll beep over the same area more than once. And here we go, it did this spot earlier. And that's normal. We might have to go over it 2 or 3 times in some cases. See how it was quicker that time? Down right behind the malleolus again. And we're gonna go under. That was a false alarm. And that was also a false alarm. When I take the sensor off the skin, it'll beep like that. And right here is that spot where it beeped before. Let's see if it beeps again, where he had some inflammation. And right there, it does it again. So, as I said, it will beep over the same area 2, even 3 times. That's why I pass over it a couple of times. This laser right here does not do the same thing. And there we go, it's done dosing that area. We're gonna run it up. That was a false alarm. And that's what's unique about this laser. It can detect areas of soft tissue inflammation and damage. I don't know of any other laser that does that. And again, I'm just scanning up the side. I know it's not a high ankle sprain, but once we get much higher than here. Okay, he's got some inflammation here. You have any tenderness up here?
Yeah, a little bit.
Okay. More of it's down here, right?
Yeah.
Yeah, and you'll see a lot of patients will say, wow, it beeped right over the spot where I have pain or tenderness. And it's not always, sometimes it's away from the site of pain. Muscles are long, they travel, so that's common to see that. But this laser stimulus impedance meter really works well. It's shocking. At first I was skeptical. Man, I spent extra for it, but they assured me it works, you gotta try it. And I said, you know what, let me splurge a little bit, get that feature. So we did, and I'm definitely glad I did, because I don't know of any laser that can detect areas of inflammation. None of them do diagnostic. They only do therapeutic, have therapeutic benefits, which is great, don't get me wrong. But having diagnostic laser is also very effective and helpful. So right here is where there's the bone, so it's hard to keep all the sensors on the skin, and that's why it beeps like that sometimes. Okay, and one last spot. And it did this spot before, remember that? We're right on that same spot. And then I'm going to have him turn over and we're gonna check his ankle, make sure it's aligned correctly, check the talus. Because when you sprain or roll your ankle in, oftentimes you subluxate bones, 26 bones in the feet, and you wanna check them. Make sure everything is functioning and working properly. And then we wanna strengthen and stabilize the joint. And I said before, if you've sprained your ankle more than once, really more than twice, 2 or 3 times or more, you have an inherent weakness in your ankle and you're going to do it again unless you rehab it. So remember this, if you've sprained your ankle twice, 3 times on the same ankle, rehab it and rehab it properly. We've done some videos on how to rehab your ankle, so make sure you check those videos out and really rehab it properly. If you need a physical therapist to do it for you and help you, then I suggest you go do that, because you're just gonna re-injure it another time, and that takes time. It could take sometimes up to a year to really strengthen it. I had the advantage of being a tennis player in college, so a lot of side-to-side motion, so I was able to build the muscles on the inside and the outside of my ankle. So you find a lot of tennis players don't sprain their ankles too often, and if they do, you have to strengthen them and focus on that. Otherwise, you're gonna re-injure them playing tennis again. Now, I'm gonna have you turn over on your back. We use glasses for safety reasons. Just wanna make sure you don't stare into the laser. Okay, now what we're gonna do is we're gonna check talus. And you can see here, I don't know if you feel that this one dorsiflexes more than this one. Not much, slightly off here. So we're just gonna correct the talus here and just relax here. And that's a little better. Now I'm just checking his calcaneus and relax here. Okay. And that's how we take care of an ankle. I just adjusted his calcaneus. I do it quickly. I'm used to doing this every day, all day for 23 years. But don't try this at home on your own ankle, okay? Go get professional help or check out my other videos on how to rehab your ankle if you've sprained it more than once or twice. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.